Doug made his directorial debut in 2009 with the award-winning documentary 9,000 Needles. Shortly thereafter, he produced and directed Under the Knife Abroad. Doug went on to direct the film Underdogs, which was released theatrically in the fall of 2013. Following that, he directed and produced 2 one-hour TV specials for AMC's Into the Badlands. Later that year, Doug returned to AMC to produce 2 documentary specials for The Walking Dead. Doug's latest documentary series, Getting to the Point, will be released early 2018.
Let me start with one of the things that impressed me most about the integration I saw in China, which I think we could learn from. And that is, when my brother was there, I remember once a week, every doctor that was involved in his care met together around his bedside to discuss the approach for the week and the approach to his care. So his physical therapist, his, herbal medicine doctor, his acupuncturist, his Tuina masseuse, whoever was touching him in any way with his care would all meet together with their head doctor, and they would discuss their approach to his care. And I think that, to me alone, was really, really something I took away, because here, as you know, when you go through some of these difficulties, you have a specialist at this office and a specialist at that office, and very rarely are they talking to each other or even sharing a lot of very important information. So I thought that was really amazing. That's I talk about a really holistic and balanced approach. That was a great start to every week. Here, I'm starting to see some really amazing programs, and I think that a couple of the places that you'll probably see me do upcoming films about are certainly the opioid addiction, certainly this great integration with cancer treatment and adults and children. We're getting ready to do something with the military and the way they use acupuncture. So I think, of course, we all know you break your leg. Certain medicines like acupuncture aren't going to do a lot to mend the bone immediately. So we need Western medicine, and there's amazing things. But I think people are starting to really see the benefits of an integrated approach. And what I always want to do as a filmmaker on this front is just, I don't want people thinking this is an either or choice. I want to show that this is actually truly something where both medicines can benefit from each other.
Beautiful. With following episodes, are they going to be revolving around the children's hospital or going toward, as you were mentioning, the opiate addiction epidemic that we're having?
What I think what the goal is, I would like to approach a different program each documentary. So we're going to move away. The next episode that we're looking at doing is actually with a retired colonel named Dr. Neem Sao, who has been very important and very active in getting acupuncture and Chinese medicine into 200 veterans hospitals with the Air Force, along with training medics in the field and special forces and all these different things to use certain protocols even in the field to help control pain. So I thought it was a really amazing story. And again, my goal is to really show stories that the general public can start to become really interested in educating in these things. And I felt a follow-up to children would be if we could tell a story about the military. These days there's a lot of support for the military. There's also a lot of trust, from the general public. And hey, if the military is doing this, there must be something to it. So I thought that would be another great story to tell that would help educate the public as well, maybe people who weren't familiar with this medicine.
What kinds of integration approaches do you think could still be done here that maybe haven't come to the level that you saw in China?
I recently met a gentleman. He was the main pain specialist at the Betty Ford Clinic that dealt with addiction. But his main focus was on children who suffered chronic pain at an early age. And from that came out the other end as at being addicted to opiates and pain medicine. And I saw some really wonderful things happen there with him using not just acupuncture, but certainly herbal medication that can then, replace some of the Western medicine, as well as like Qigong and Tai Chi and all these wonderful things with these children that really help them to learn how to control their pain in a different way. The reason I bring that up is that in China, one of the things that I didn't get to cover in really either of these documentaries, my first one, 9,000 Needles, or Getting to the Point, and it's probably an area I understand the least about, which was the herbal medications and the herbal supplementation. With my brother, when he first got to China, I mean, he was, leaning over in his wheelchair and drooling, and we all thought it was from the stroke. And as they started treating him, they were very careful about understanding what medications he'd been put on and using an herbal medication program that would eventually allow them to cut back on the Western medicines. But they were also very adamant about saying, hey, we're not going to pull them off everything. We're going to find a way that these two things can work together until we figure out what works for him. So it's probably something you know more about than I do, but I will tell you that the stuff they did with the herbal side of whatever medications, he called it brown sludge because half the time was in it. But I will tell you, we were able to take him off big amounts of muscle relax. When you have a stroke, you get spasticity, and they throw muscle relaxer, or not muscle relaxers, but they throw certain medicines. I can't remember them this many years later to try and take the spasticity out of those muscles so they're not so tense. But with that, you lose all control and you become kind of a sack of potatoes. So, and same with this program with Getting to the Point. When people see the film, we really do concentrate on acupuncture because it's kind of the focus of the film. But both parents shared with me so much more about their nutrition and the different kind of holistic medications and care they were able to use in assisting their children in healing or towards their recovery. So.
Oh, excellent. Yeah, Lan's PhD is in herb to drug interactions. And one of the things I was struck by when I got to China the first time was I had always thought that there was traditional medicine and then there was Western medicine. But they also have this branch called herbal pharmacy where they look at the research behind how these medicines are working. And this creates such a beautiful bridge behind, what is qi, what is yin. We're able to sew up a lot of those questions by looking at all of the herbs that boost qi or all of the herbs that boost yin. And then you can look at how they're affecting animals and humans. And I think it's very understated and very promising area of study, and potentially one that can completely sew together Chinese and Western medicine. The challenge I see is that everyone in this department, they're mega nerds. I mean, the nerds of the nerds. So they'll get giddy about micro improvement to colon targeting, but they're not out there talking about themselves. So,
well, that's you bring up a really good point, because I would love to do somewhere in this series. I want to do a segment that really focuses on everything you just said. And again, I think the power with film is when you bring up like micro nerds. One of the biggest challenges I had at doing films about like acupuncture and Chinese medicine was, as a layman in the beginning, somebody gets on and starts getting fired up talking about, fire in this part of your body. And when in Chinese medicine, when they mention your heart, they're not just talking about the heart, they're talking about this whole system. And it can be hard to explain to a Western mind in a very clear way. And what I found is finding real people that we can relate to and finding their stories and allowing us to learn through their stories, almost as if it's like a Cliff's Notes to, sorry, I'm aging myself again because some of your audience probably don't even know what Cliff's Notes are, but it's kind of like, or acupuncture for dummies in a way. It's a very basic way to get people to start understanding and thinking about what happens. And so I think even with the herbal pharmacy idea, I think it'd be important for us to do one of these segments that gear towards that, and then finding people, again, since I'm not in that community, sometimes as a filmmaker I can work with an idea and allow the story to kind of show a more general understanding of it. And so it'll be fine. You might help me find some people that can explain this very clearly, and maybe we can do a whole segment about that.
You mentioned before about Dr. Loudon and his take on integration within the United States.
Yes, recently we had a screening of the film, and Dr. Loudon is a pediatric neurosurgeon in the film who his primary job is he operates on young children's brains. And so about as Western as you can get in the beginning when you meet him. That's a pretty specific job. But he was a big person. He was a big person involved in helping integrate Chinese medicine into the Children's Hospital of Orange County. So that's pretty much what the film focuses on. But we had a discussion the other day, and we had a panel discussion after the film, and one of the acupuncturists asked a question about, well, what are you allowed to use in the hospital and what aren't you? Can you give patients herbal medications? And so we had a nice discussion about right now they're able to use acupuncture, they're able to use tuina, cupping, some very specific sides of Eastern medicine. What they aren't able to use right now in the hospital system is the herbal side of the medications. And so somebody asked why, and Dr. Loudon said, well, we're at the beginning stages and we have a great opportunity to bring Chinese medicine into these hospitals, but we also have to be very careful. And one of the problems with bringing the herbal medications is right now is the formulation of them and how are they regulated, and how can a hospital, I guess you may know better than I, but I never thought of it that way. But he said, we've got to work together at figuring this out because right now there's no real regulation on formulating these medicines, and that's something that the hospital, can't get behind at this point in time. Now, in the future, that may change, but they were saying we're at the stage right now that even as an acupuncturist, we have to be very careful because they're open to checking this out. But we can't even leave a needle behind in the bed. We can't even walk out of the room and accidentally leave a needle in a patient's arm. We have to be super vigilant about showing how professional we can be in doing this and taking this one step at a time with the hospital. So I really thought that was amazing coming out of his mind, because he knows better than anybody how hard it is to get this into an actual hospital system, and I guess what we need to do going forward. And he's been very willing to talk to other practitioners about the process they use and share that, so that if somebody wants to get involved in helping to bring this Eastern medicine into the Western organizations, then they're willing to help and share the way in which they did it.
Oh, that's beautiful. It seems that your work tends to revolve quite a bit around children. Is there, besides that kids are cute, is there a reason for this?
Well, I mean, yes and no. I have an affinity, I think, towards young people because I'm becoming an old person, but also because there's I guess there's an innocence to younger people. They're still forming opinions. They haven't quite been affected by these deep beliefs or these deep belief systems that close them down to things. And also, I think especially when you get into, I think, alternative type medicines and Chinese medicine, all these things, children, especially young children, you kind of lose sometimes the placebo effect argument, right? Because they don't really know. I think that a child goes into a treatment like acupuncture and they don't have a formed opinion about it one way or another. And so when you see it work, it can be very powerful. When you see these medicines work, I have to tell you, going through it with my own parents, it's a hard choice for a parent when their kid is going through some kind of terrible, situation like, say, a brain tumor, and somebody says, hey, why don't you try acupuncture? If they're not familiar with it, that's a really hard jump to make, because they're just like, whoa, wait a minute here. I've got to deal with my neurosurgeon, and I've got to deal with this. And we don't, it's really hard to consider some of these holistic approaches if you haven't been exposed to them in the past. And so I think with these films, I think showing just giving them, opening up the option to start looking at these things. I'm not saying it's for everybody, but certainly you watch a film, and I get calls and emails all the time now from parents and people asking, can I help them find somebody in their area, and what do I think? And I have to always be very careful because I'm not a doctor. I can't tell them whether I think Chinese medicine will help or not, but I can certainly share my experience and then guide them where they can get the information.
That's excellent. Well, I think I can speak for many people within the holistic community, the acupuncture community, in thanking you for being a storyteller for all of us and being part of that bridge between the best of what's in China and integration within the United States and the Western world at large. What is it that we can do back for you as a community?
Well, thank you for that, and I appreciate it. And I'd never expected that I would be the voice of, although I've been a big believer my whole life, I didn't know that I was going to, that my film, a big portion of my career was going to be aimed at this kind of stuff. And it really has over the last 5 or 6 years. So you never know, but I'm proud to do it and I'm happy to do it. And I think what I want to do and what I would ask for in return are kind of the same thing. I made this particular film for the acupuncture community and with the community, 30 minutes in length, because what I really want to do is I want practitioners to contact us and I want them to actually hold a screening in their community. I'm working with Matt at the Acupuncture Now Foundation to allow them to use this tool for free. I want them to use this film to show their patients, but also encourage the community to come in. And it's a half an hour long so that within an hour they can show the film and then they can have a Q&A and they can answer questions about their own practice or what they have to offer. So that being said, the way people can help me is they can support us with this by going to the acupuncturenowfoundation.org, which is the website. This is where people can donate whatever they can. It can be $5, it can be $500. But I really would ask people to become partners. This whole film was funded by the acupuncture community and the holistic health community and by donations. So we want to keep doing these episodes, and we rely heavily on people's donations. There's a couple great things. This is a nonprofit film, and the Acupuncture Now Foundation is a nonprofit organization. So some of the companies that donated to us, of course, get write-offs. So do individuals, if that's important to people when they're deciding where to give their altruistic and money. But so that's a really good thing. We are doing a nonprofit, and they will get a write-off for that. That's really what I ask of people, if they can, to support us in that way so we can keep making these films. And then in return, I can keep providing them to our tribe of healers out there to use in their own communities to educate people about what it is they do.
Excellent. And how can people contact? You mentioned the Acupuncture Now Foundation.
Yes, the Acupuncture Now Foundation is the best place for people to start if they're interested in donating to the film, and also if they would be interested in organizing some community screenings. The film right now is not available to the public. We have a couple more screenings coming up in April here that are just one's at an acupuncture symposium in Kansas City. Another will be at the Children's Hospital in Orange County, where we're going to kind of premiere the film there. But the film will be released in May for children's, I believe it's Brain Cancer Awareness Month, and we are going to release the film to the public in conjunction with that. So people will be able to see the film very soon. They can see trailers and information about it at the Acupuncture Now Foundation. They can contact Matthew Bauer there with any questions about screening in their communities and things like that. The other amazing thing, real quick, is for acupuncturists, the Acupuncture Now Foundation offers a few classes. I believe that acupuncturists have to take a certain amount of continuing education classes every year. He's offering them through that foundation. And again, the nice thing about that is that money not only gets you a continuing education class, but you're also donating to these kind of causes. So it's a great way for an acupuncturist to support the film and also, in trade-off, get some of the continuing education credits they need for their practice.
Mm-hmm. And the stories that we can't tell ourselves. So thank you
Yes.
so much for that again. If you'd like to receive an email from us on show content, references, and additional information, such as contact for our guests, please go to botanicalbiohacking.com, scroll all the way to the bottom, and sign up. We have practitioner and general sign up. Also, please remember to rate us on Stitcher and iTunes.